Hello, and thank you for joining us here for this fireside chat session. I'm Jeanne Weiss, VP of Customer Success at Revenera, and I'm here today with Tim Donahugh, who's the Director of Program Management at GE Healthcare. And this afternoon, we're going to talk about going digital with subscriptions and electronic software delivery, or ESD. Tim and the GE Healthcare team have been on quite a journey over the past few years as they work to develop and implement ESD and licensing. And I'm thrilled that Tim agreed to share some of those aspects of their voyage with us here today. So just a quick comment for the audience. If you have any questions along the way, please feel free to type them into the chat. We'll do our best and attempt to answer them as we go along. And I'll just double check when we're at the end of the session too, to make sure that nobody else has any, but go ahead and put them right in the chat. So Tim, first, let's spend a minute or two having you tell us about your role at GE Healthcare.
Sure. Thanks. Pleasure to be here, Jeanne. So my role at GE Healthcare as Director of Program Management is to really help facilitate the digital transformation from physical media of software and licensing to virtual delivery of software and licensing, and also support our efforts to really scale up our ability to do subscriptions. I've had over 20 years of experience at GE. It's really been a really fantastic journey, and I'm happy to be a part of the team that's driving this transformation.
Great, thanks. And Tim, just in case anyone listening is not familiar with GE Healthcare, could you tell us a little bit about what your company does in this aspect of GE? What do they do?
Yeah, GE Healthcare is actually one of the leaders within the medical industry in terms of equipment. We cover four major business units. One is imaging, which probably most are familiar with. And this is your CT, MR, X-ray products. We also have an ultrasound business, which does cardiovascular ultrasound, general imaging, women's health. We have a patient care solutions segment, which is more the smaller items. So EKGs, treadmills, monitoring. We also have bone densitometry as part of that offering as well. Maternal infant care. And then we do have one more with pharmaceutical diagnostics is one of the other major business units that we support.
Okay. Yeah, and when you were just talking about that, I definitely can visualize, again, going into like a hospital setting, or specifically, Tim, like an MRI machine, right? Very big pieces of hardware, that I can visually see. But if we can take it a step beyond that, right, and talk about the software, can you talk about at a high level, how does GE Healthcare use software along with those large, more typical things that we're used to?
Yeah, that's actually a really great question. And I think that's one area that gets overlooked quite a bit. When you start thinking about evolutions in technology, some of it, yes, is very much on the hardware side. But as, software and computers start to play a more pivotal, continue to play a more pivotal role in, our ability to diagnose patients, this is where, being able to deliver software, provide different features becomes critically important. Which is why, subscription is also an important component that's a part of our long-term vision and roadmap. We have different offerings in terms of partnering with different scientists and have them develop their analytics within our environment that we can then deploy in our equipment. So like We Echo, as an example, is one product where, our customers can interact with another physician for help using some of those applications. And then also different offerings that we go out the door help with help physicians and radiologists with better diagnosis.
Okay, great, thank you for that. And then how does the licensing? What's the use case for the licensing? How does that play into this whole scenario?
Yeah, and anytime that you start with software, it's like anything else that's happening within the industry, with subscriptions and different offerings that we're trying to do. So licensing plays a very important role because it allows us to ensure that we can distribute software. It's going to the right person, the right piece of equipment. We can help maintain control, intellectual property from that perspective. And where we need to make some adjustments, we know from a traceability standpoint where it's gone.
Tim, do me a favor, remind me, there's a great use case that you talked about, people in the field versus being able to use do things remotely. Can you share that example again, which is my favorite?
Yeah, so one of the things that we've done quite a bit is we have several areas where we can dial into our equipment. We can help fix things remotely. So if customers have issues with their products and we need to, download software to, resolve that particular issue, we have that ability to do that. And that's one of the features that, we've been able to pretty successfully utilize, partnering with Revenera.
Great, great. Okay, let's flip to the next slide if we can. I have a little quiz for the audience. Perfect, great, thanks so much. So on the top, and you can see because Tim has the older GE Healthcare logo, you can see it there in blue, and then we've got the dates on that. And then hot off the press, right? GE Healthcare came up with a new logo that you can see kind of on the bottom right, and it's in this passionate purple color, right, Tim, that we talk about. But really quick, I wanted to kind of quickly ask the listening audience, if you would put in the chat, if you look at the older logo for GE Healthcare and the newer one, besides the color, type in the chat, what do you notice that's different in the logo? So again, besides the color, type in the chat, what do you see or notice that's different between the old GE Healthcare logo and the new one? I'm just going to wait a quick minute here. Little quiz.
Yeah, I bet nobody expected a quiz.
All right. As they're still thinking about that, Tim, can you tell us from the old and the new, what's the difference? And then maybe tell us why you guys chose it, because I think it's relevant as we talk about licensing.
Yeah, absolutely. This year's actually been a pretty exciting year for GE Healthcare, being the first of the companies to divest off of GE parent. So as we looked at what our mission was, we created, our mission right now is to create a world where healthcare has no limits. And so when we put healthcare in the center of everything that we do, that's why the H and the C are actually capitalized as part of healthcare. The other thing that you're going to note is that the letters are actually kind of curved into each other, which represents the patient's journey throughout the entire healthcare, system, if you will. I think any of us that have been touched by any type of medical event in some way, shape, or form, it's never a one-time thing. It's always some type of journey that actually goes through. So that's why the letters, the E and the A in particular, kind of curve into one another. The other thing, purple is actually a very important component of this too. So the compassion purple speaks to, our compassion for our employees and also our empathy for our patients as well.
Oh, and I got that one wrong. It's compassion purple, not passionate purple. My bad. Okay, sorry about that. Okay, great. So Tim, thanks for that. And thanks for the audience for participating. I love that mantra. I love the marketing aspect so that you're constantly thinking about the care of the patients. And I kind of started out by saying we've been on this long journey together, right? And GE Healthcare, I think, is finally at the point now where you guys have created a vision for your e-delivery and licensing. Can you share some aspects of that?
Sure. When we looked at kind of where we were with our software delivery and our licensing journey, there were several things that actually came to mind. We broke them into 4 pillars. Of the 4 pillars, obviously growth is one area that we were looking at. We talked a little bit about that today in terms of our licensing strategy, our subscription strategies. The other thing we started thinking about when we removing physical media off of our shelves and making that drives productivity. If you look across any industry that leverages computers, cybersecurity is also a very important component. And then our ability to deploy software out to our customers quickly and safely is also extremely important, which became another pillar. And then finally is some of the customer expectations. We're in the 2020s. Most people expect software to be delivered like it's being delivered onto your iPhone. We just came out of a situation with COVID. There's still a lot of that going on. And then anytime we have to send somebody to site to upload software or manage software, that may not always be the best customer experience. And so our customers are expecting us to be able to do that stuff remotely as well.
Really interesting. Yeah, that's good.
Yeah. And so as we were kind of going through that, growth, productivity, security and deployment, and the customer expectations kind of became those components where we constantly go back to. And when we talk about the different use cases, we try to make sure it ties into one of these pillars.
Perfect. Love it. And love that you guys have created the vision. And thanks for bringing up security. It's definitely a hot button kind of across the layers, right? Most companies are really thinking about this.
Right.
And you mentioned it a little bit, Tim, but maybe you can double click how security or are you getting more demands from your end users on security?
Yeah, with GE Healthcare, particularly in the healthcare industry by itself, is extremely important that we maintain a level of security. So being able to deliver software remotely, we have the right connections. We're doing that safely. We, have our equipment protected. Secure patient, information, that type of stuff is also extremely important to us. And so, as we're looking at delivering software, this is actually one of the key pillars that we're trying to ensure. The other thing we're talking about security is protection of our intellectual property as well. And so, for our ability to license software or license any of the analytics that we can deploy, that allows it making sure that it goes to the right equipment, the right customers, et cetera, versus having widespread distribution of it.
Okay, good. And I think, Tim, I know you talked a few minutes ago about how you guys are set up and so forth. And I think you refer to the different layers in your organization as modalities, right? I'm wondering, as you guys put this vision together, and again, it's over time that you got to this point.
Mm-hmm.
Can you talk about like those different modalities? Was everybody on the bus with you? Is everybody at the same place? Is everybody? Do they follow the same and believe in this vision, or was there any issues getting these modalities along the ride with you?
Yeah, no, that's a great question. I think from a visionary standpoint, definitely people resonate with the four pillars that we have. Everybody ready to jump on the bus right away? No, it's like one of those things, it's like, well, you go first and then I'll follow you. So as we've been kind of going through this journey, our business units, our modalities, in some cases, actually started going down different paths. So on our imaging side, they decided to go down the field modification instruction path, or providing updates into the field quicker than introducing it into the new products. On our patient care solution sides, they went the opposite direction. They wanted to get it embedded into their new products to start, and now they're starting catching up on the the updates process after the fact. But it was a different approach by each modality. The reason for one versus another is that on our imaging side, they felt it was better that they could have an immediate impact to the customers, so they went that route first, because for our new product cycles, especially for our imaging products, are much longer than our patient care solutions development cycle.
Okay, good. And that's really key. I think talking about how you got all these different modalities on board and signed up to the same vision is a good lesson learned. And I think that's another area that you were going to share with us, right? Is, as you look back, what are the things, or what is the guidance that you can give to others that might be on the same journey?
Yeah. So for us, as we were talking about the different business units and the different modalities, we looked for those small wins. So those quick wins, start small type of things. So one modality, one product, looking at an upgrade. One modality, one product, looking at a new product introduction, making sure that that can fit their particular use case. It allows you to identify the entire processes, because it's not just a technical solution, it's also a process solution that you're going to be implementing, because moving to digital delivery is different than physical shipments of material. The second thing that we really needed to do is we made sure that we had some grassroots efforts going for us, but also we needed to make sure that we had leadership engagement. And a lot of that had to be with, trying to align on a common language, because when we learned and talked to the different business units, folks were using the same term to mean different things. We had to go through, redefine what we were actually looking for. And that allowed us to make sure that we had the right leadership engagement, the right leadership understanding. That helped translate and communicate down into our different teams that we were working with for, integration within the product, or integration within the different functions, as we were developing not only the technical solution, but also the process solutions. And then finally, it's really talking about being patient as we go through this. Some people are a little bit more resistant because it's like technology is a little bit scary, as you're making and putting in something new. But, having that patience so that you can slow down to go fast in the future is one of the important things that we were trying to implement as we go. It has been a journey for us. It's not a quick sprint, but something that just allows you to quickly go through. For the Boston Marathon folks that ran through this past week. So, but the big thing here also is look for those biggest challenges, the biggest things that you could, the biggest, hurdles, the biggest naysayers, pull those people in, make them part of your process. And you come to find out that you can actually, get them to be some of the key champions as you, kind of reinvigorate some of this effort going forward.
Love that. And I love the topic that you brought about common language and perhaps different things meaning different things to certain people, or the vernacular, right? So
Right.
can you talk a little bit more, Tim, too, about how did you bring senior leadership along the way? So we have kind of a team that kind of is working in the trenches, right? Making sure that you're pulling the vision together, getting the modalities. But how did you then either solidify this common language, or then how did you keep senior leadership informed on where you are on the process?
Yeah, we actually met with them quarterly so that they kind of got a sense of, what's the cadence within their particular business unit. How's the adoption actually going? What help do they need to provide from their teams to us? Um, when we kind of worked to get that senior leaders aligned, they actually thought we were doing a lot more. And I think it was because of the different terminology that was, being tossed around pretty easily. When somebody says licensing, it's like, well, how are you talking about licensing? Are you talking about actually true licensing or permanent licensing? And so making sure they understood what we were doing, how we were implementing it, and how that actually trickled down and getting into their products and affecting customers and patients is the way that we were able to get that senior leadership alignment. And then that orderly rhythm allowed us to continually show progress and where we needed that help for them to step in, or maybe we needed some additional help from their teams, and it really stepped in and helped quite a bit.
That's great. That's great. And maybe last question here, Tim, on this. What about either your end customers or perhaps other partners that you needed to bring in? How did you bring them along your journey?
Yeah, so I think for our end customers, quite a few of them were expecting this to be done in the first place. So as we started, kind of actually implementing this, it was like for them an expectation that we really wanted to do and continue to move ahead very quickly. Um, as you look across the globe with the different regulatory agencies that we deal with as well, it's also making sure that we, adhere to those components and those requirements, and making sure that we kind of meet those customer expectations. So definitely something they've been looking to do for quite a while. And then our business partners across the world that we deal with and services as well, that's kind of an expectation. They're like, all right, good. Now we can do this. Now we can reach patients much, much quicker. We can get to our equipment much, much faster, and we can keep it updated and with the latest and greatest, versions of software or the latest and greatest features that we're deploying or selling. This has really been one of those key things that has helped us do that.
Great. And that brings us right back to almost where we started, right, with the compassionate purple, not passionate purple, but the compassionate purple,
Right.
and then the C in healthcare, right? So that you're really thinking about the patient and the end customers, the end customers on that. So okay, perfect. And then I think kind of the last area that we wanted to get to, Tim, is really on results, because obviously we talked about this journey that you guys are on and the expectation from senior leadership and so forth. Can you talk a little bit about the focus on results within GE Healthcare?
Yeah. It's GE Healthcare, like anything else, is a business, right? And we're
Mhm.
out to, patients are at the core of what we do. And then with that being at the core of what we do, there's always benefit in launching stuff like this. So first of all, growth, it was one of the key pillars that we have at the top. We're seeing it. So we're seeing it in terms of, we're getting more software updates out there. We're selling more upgrades. We're having more analytics being available to our end customers that provide better insights to diagnostics. Um, it also allows us to internally get more products to adopt digital delivery of software and licensing and subscription management, which we were doing and have been doing for over 20 years. The only difference is we actually needed to send a field engineer to kind of help manage that licensing. Here we can do it remotely. Others is we're really starting to see this return. So when you talk about, the reduction in material spend, the environmental consequences of not having to burn a CD or a DVD anymore, we're seeing some benefits there from a material perspective. And also our speed in deploying software has actually gone pretty quickly, because now I don't have to worry about shipping, CDs across the world. I can deploy my software in a virtual manner and reach all my customers within a matter of weeks versus months if I've got to ship something. The other thing on return is it's actually increasing our field capacity, because if you think about, I can have my field engineers kind of work on the more difficult issues than having them send a site and just doing a software update, as an example. We can get those experts in the areas that we need, where customers really need their help. And then the traceability piece is pretty important thing to note. As we're using Revenera to kind of manage our licensing and our software, it's allowing us to map software and devices in a much, much faster manner and keep that up to date much easier than, trying to find, okay, remember somebody manually typed in, the serial number of the software on the device. Even though we're doing it, it helps mistake proof a lot of that stuff and give us better visibility and traceability. And it also allows us to really focus in on some of the deployments. If you've got version 1 and she's got version 2, I can make sure the software is going to the right person who has the latest version or has purchased that particular upgrade. I can be prescriptive on where it actually goes. So we're seeing benefit for all of these areas over the last several years that we've been working on going through this journey.
Awesome. And I love it. And by the way, Tim, I am smiling while you're telling this story, because I am, I can remember the day where you would go in and you would leave and they would give you a DVD, or like worse than that, even antiquated, right? Further than that. And now you're like, no, you don't have it. It just goes, right? It just goes. So I'm totally getting this picture. So thank you for that. On the first one for growth, Tim, here you have more new products as one of the sub bullets under there, and I'm just wondering. We talked a little bit about the modalities, from lessons learned and getting the teams come along. But then, how do you guys determine when is the right time to fold in a new product, or we're good to go over here now? Let's move this over here.
Yeah, really, it really depends on how our partnership with the modality is actually going. It's one of those things where the technology that they want to deploy, is it right for them at this particular moment in time? So, like, for instance, if we've got like a maternal infant care unit that's going to move around quite a bit, that may not be something that we want to target right now. If we've got an Advantage workstation offering that we're looking at selling multiple software features to it, they're going to be one that's going to be adopting this in a much faster manner than the other ones. So it's based on kind of the product, where they're headed, what their vision is, and what their current development cycle looks like, and that allows us to support in different manners. And so as we look at that, that's where we kind of can assess and say, okay, yeah, these guys are really ready to go. These other ones maybe not so much, and maybe we can catch them on the next development cycle.
Okay, good. And then maybe the last question here on results, Tim, right, is I'm assuming that along this journey, you guys have created KPIs or metrics along the way, right, that you're now looking at as it relates to specifically what you have on here. And then, so I'm assuming, is that a safe assumption? Yes or no? And then 2, who governs those KPIs in your organization?
Yeah, no, that's a good question. So we have been and continue to develop, and I would say maybe modify or grow our metrics. They've kind of evolved over time. Before it was like, how many deployments are we doing? How many terabytes are we downloading? Now we're actually at a point where it's like, okay, so let's talk about the type of delivery that we're doing. Are we, providing an update? Are we talking security patches? Are we talking patches in general? Are we looking at load from code capabilities? Having us looking at that from that type of lens now versus just a pure, did you download software, yes or no? Now we're getting into a much more dynamic, and we're looking at the modalities and saying, how's the adoption rate actually happening?
Okay. And by the way, wink, wink, I know the answer to this, but did you also have to think about from an organizational structure, right? So now you have KPIs and metrics, and now you have to show results. Did you have to add additional roles or change people's roles within your organization, like so that now somebody is responsible to manage those KPIs?
Yeah, we started off with a small support operations team, and they're continuing to grow in their responsibilities. So some of it is, very much in line with what we're talking about here from KPIs. But also, when we had to look organizationally and say, do we have the right support to help drive this transformation? We were a very small team. We've continued to grow in size because of the benefit that we're delivering to the business, but also one other thing that we've done is we've also partnered very strongly with our supply chain, and we end up having to develop a completely new organization within that team to help drive our transformation from a supply chain standpoint.
Okay. Um, Yeah, and I'm wink because I know who that person is, Tim. That's why I was saying it. So actually, I have one other question before I get to that. Really quick, we're almost at the end of our chat here. If anybody has any questions, feel free to put them in the session. We've got just a few minutes left, but we'll make sure that before we say goodbye to Tim, we'll get to those. But what I was going to ask you, again, in that increased field capacity bullet that you have there, Tim, under the return, is that something that you saw right away? Is it something that's increasing or trending over time? How are you guys capturing what that looks like? And is it safe to assume that it goes back to the example that you've given now where you're not having to send somebody physically out in the field? Is that piece of it?
Yeah, that's that piece of it. And, honestly, increasing that field capacity is something that's taking time, right? It's not something that's going to happen overnight, simply because the fact that we talked about the technology piece early on. When you move from physical shipment and physical installation of software to virtual installation of software, there's a piece of the technology in the back office that needs to take place, and there's a piece of technology on the product itself that needs to take place. And so that's where that new product introduction component plays in, where it's like we need to get those products rolling out the door. And then as we get those products rolling out the door with this particular type of capability, then that allows us to, slowly over time, do things more remotely than, when we would have done in the past.
Great. Wonderful. And again, I'm thinking back to your other slide that says be patient, right? Or like this takes time, and it's not a fast race, right? It's a slow one. So I absolutely love that. So, well, great. Tim, thank you so very much.